When they heard about people who were stricken with disease, they knew in their hearts they had to take action. It was the Franciscan thing to do. Unafraid, they traveled to a place far away in the middle of the Pacific Ocean, not knowing what to expect. They put the needs of others first, hungry to serve those who no one wanted to serve. St. Marianne Cope and the Sisters of St. Francis came to Hawaii to make a difference. They met less than ideal conditions, but remained undaunted. They brought light into darkness and overcame every challenge with creativity and innovation to break through barriers. The moment they said yes to God in their hearts, they remained steadfast, determined to love and serve those who were considered outcasts because they had Hansen's disease. This same can-do spirit and tenacity propels St. Francis Healthcare System of Hawaii forward. There are tremendous needs in our community today, especially among Hawaii's growing number of seniors and their family caregivers. We have been called to carry on the legacy of caring that began with St. Marianne and the Sisters. Today, St. Francis Healthcare System provides a wide range of services. St. Francis Hospice provides home hospice care and inpatient hospice care at Nu'uanu. In-home bathing and personal care services for those who need assistance with caring for themselves. Adult daycare in Manoa and Ewa to meet the needs of seniors and caregivers. A flourishing preschool as a separate program at the St. Francis Intergenerational Center. Franciscan Vistas Ewa, an affordable, independent living community for seniors that is always in high demand. A spiritual retreat center with a homeless outreach and transitional home program at Our Lady of Ke'a'au in Waianae, and a bone marrow donor registry to find a match so patients can have the life-saving transplant they need. We are called to change lives, to touch the hearts of others in lasting ways. We are in the business of creating healthy communities, reducing health disparities, and transforming society. It is a vision inspired by God. It's stretching us in exciting ways, opening our eyes and hearts to new possibilities, and causing us to grow individually and together as a team. We are a sponsored ministry of the Sisters of St. Francis, and each of us is called to carry on the work of the Sisters of St. Francis. We co-labor with them to uphold high-quality, compassionate care to deliver positive health outcomes for patients. The Liliha campus features numerous physicians with individual practices in internal medicine, oncology, cardiology, geriatrics, and many other specialties. We also have other providers such as the Cancer Center of Hawaii, Hawaii Endoscopy Center, Hawaii Diagnostic Radiology Services, Hawaii Pacific Neuroscience, Liberty Dialysis, PharmaCare, and others. But our work is not yet over. We must change as the needs of the community change. With Hawaii's rapidly growing senior population, we must be ready to care for them. We turn to St. Marianne and the Sisters as our examples. In their humility, the Sisters recognized they could not complete their pioneering work alone. They sought other partners to help meet the needs of the community. Today, we continue to select partners who share our vision and values to work alongside us in perpetuating our inherited legacy of caring. St. Francis Healthcare System recognizes we have a big responsibility and a big vision. The transformation of our Liliha campus into the St. Francis Kupuna Village continues to move forward. We envision a welcoming haven of health and wellness for Hawaii's growing number of seniors and their caregivers, a place for quality care for the body, soul, and spirit. It is one of the biggest undertakings in the history of St. Francis. It will not occur overnight. We will continue to invite partners who share our mission to help us meet the growing, ever-changing needs of the community. The St. Francis Kupuna Village will offer seamless transitions across the continuum of care. It currently features the Clarence T.C. Ching Villas, a skilled nursing facility for those who may need specialized care or rehabilitation. This facility also accepts hospice patients from St. Francis Hospice. The St. Francis Kupuna Village will continue to expand and offer new services on the 8-acre campus. In collaboration with partners, our future campus will also offer an assisted living facility, senior community center with an expansive courtyard and bistro, adult daycare, and an independent living complex. Exciting changes are happening at St. Francis. St. Marianne and the Sisters serve as our inspiration and models of innovation as we move forward together to create a vibrant, sustainable healthcare system. We are stewards of this great legacy, and like St. Marianne and the Sisters, we are willing to give our all so we can provide quality, compassionate care for all those in need for years to come. Let us be like the Sisters, unafraid to chart new territory, open to new challenges, and ready to find new, innovative solutions to create healthy communities. The momentum has begun. Let's keep moving forward, driven with God's compassion and hearts ready to serve.